At Dr. Sellars Educate, we help nurse educators and leaders advance their skills, pass the certification exam, and achieve excellence in nursing. Whether you're preparing for the CNE, CHSE, or CNML exam, our coaching programs, masterclasses, and study resources are designed to help you succeed with confidence. We provide a NCC-accredited continuing education, faculty development workshops, and practical strategies to strengthen teaching excellence, simulation, curriculum design, and accreditation readiness. We partner with schools of nursing and healthcare organizations to support faculty development, certification initiatives, accreditation preparation, and educational excellence. More than 5,000 educators have trusted Dr. Sellars Educate to support their professional growth and certification journey. Visit us to learn more and join a community committed to excellence.
When your student is struggling, do you step in right away and help them with the answer? Do you give them time to really process the information in a way that allows them to learn from their struggle so that it's more productive? Or do you quickly engage with them to rescue them in order for them to not feel frustrated or overwhelmed? What if us jumping in too quickly actually lends itself to being a barrier to the learning process? This is what we're going to explore in our conversation today as we take a deeper look in determining what are some of those barriers to learning that we may be responsible for. How do we get over those? And most importantly, how can we enrich that learning experience so our students are leveraging the expertise, the talent, the strengths that we bring into that learning experience, and we're not creating barriers for them? Welcome back, everybody, to Dr. Sellars Educate, where our mission is to support all nurses, all nurse educators, and nurse leaders on the journey to achieve excellence. For some of you, that is achieving a passing score on the CNE exam or CHESI exam, and we want to celebrate with you all. So keep us updated on your journey. The only way you want to achieve success is if you quit. So we look forward to hearing from more of you about your success. Okay, so a couple of housekeeping tips. Let's go ahead and take a look at our devotional. So we like to start out with a devotional from our devotional book, Rooted in Wisdom. There are actually 365 devotionals, one for every single day of the year, to help you stay rooted and grounded in your purpose. I know it helps me because not every day turns out to be the ideal day for me or the day that I planned. And so taking some time to really reflect on my why, deeply aligning with purpose. For me, it's a scripture and also a reflective moment to think about how I can get just 1% better every day. So we're going to look at, let me see which devotional I decided to share in our time together today. I'm using Prezi today, so sometimes it takes me a minute to situate myself. Okay, let me make sure you all can see it. Okay, it looks like you should be able to see it. So here we go. Our devotional for today is day 21. True learning is not just about personal growth, it is about lifting others. When we share what we've learned, we contribute to a culture of collaboration and excellence in nursing education. Oh, that's a good one. A big part of our journey really is about this personal growth, right? We have to realize where our knowledge gaps are, where our biggest opportunities are, and then we can build on growing ourselves within that space, within that opportunity to get a little bit better every single day. Here's the question we're asking ourselves. Are we as nurse educators creating dependent learners? Are we part of the problem or are we part of the solution? So we're going to start out just asking ourselves or considering three thoughts. So number one, do we ask questions? Are we looking past the basic facts of a case? When we are developing unfolding case studies or students are sharing their lived experiences as unfolding case studies, do we engage in Socratic inquiry? Do we ask those open-ended questions that are essential for students to go deeper in that learning? So that's what we mean by looking past the basic facts. Yes, students have to understand those concepts, but we want them to go deeper and understand the rationale, be able to analyze. All right, which speaking of analyzing, for our content today, we're going to align it with Billings and Halstead. Specifically, you're going to take a look on page 338. This is in the 6th edition, box 18.1, where it talks about clinical reasoning, gives you a specific example And then it walks you through those elements, those phases and expectations that we have of students to be able to process what's going on with a patient who is experiencing pulmonary edema. Starting on page 336 through 340 is going to be the content that you will use to have a deeper understanding related to our conversation today. Okay, and next you want to think about past learning. What past learning experiences do our students engage in that will help them really have this deeper understanding of learning that we need for them to? We want to think about any new information that students are exposed to or that they are trying to process. We want to be clear about what those policies are as it relates to the medical orders that are written, perhaps or maybe it's even the policies and procedures of the organization of that healthcare organization. So we want to make sure there's alignment with any past learning with policies and procedures to help increase students' awareness and knowledge. Third is being able to test those ideas. So we want to think about what might happen before the student actually takes on that specific practice. So one example could be really engaging in those unfolding case studies, having a deeper view of those unfolding case studies so students understand the rationale and are able to analyze, first of all, their interventions, and then be able to really articulate that in a way that makes sense, right? That's salience, so that students, when they get to the actual bedside, they're able to make safe patient care decisions, not only based on competency, but based on confidence as well. Again, testing those ideas is going to look like unfolding case studies. It could look like discussions. It could look like simulation. But students are able to really gather their thoughts based on their prior learning, based on their prior experience, make a decision verbally or demonstrate it in a low stakes environment so that they can build on that before they're actually at the bedside. Okay, so now let's incorporate well, actually, before we go to our thought provoking question and our content, this is a resource and it's listed also in the description that is going to go a little bit deeper when it comes to critical thinking, clinical judgment. And this is from Nursing World ANA. So that's why I wanted to cite this reference. Even though it's been a little bit since it was published, it's still a really good article for you to take a look at. Now we're going to explore from a nurse educator standpoint. Let's dig into some of these concepts, and I want to make sure that my view is good to go. Okay, because earlier I had the side-by-side view and I want to make sure that's not still happening. That was actually happening in a previous recording and it didn't come out quite like we had hoped. Okay, perfect. So now what we want to talk about is a little bit of the content to provide that foundation for you all as you're thinking about where your knowledge gaps are. So here's the question, going back to where we started. Are we part of the problem? How, if we are part of the problem, how do we become more of the solution? So first and foremost, we're thinking about the importance of learner independence. So studies have shown, including research that's cited in the previous reference, that's again also in the description, studies have shown that independent critical thinking improves patient outcomes by up to 30%. 30%. So our patients are able and more likely to receive safer patient care 30% of the time, increased by 30% of the time when we are, as nurse educators, supporting that independent thinking. So, what does that translate into? Our students are able to make those safe patient care decisions when they get to the bedside because they've had more iterations in a low stakes environment. We've given them feedback, and they're not only competent, but again, they're confident, right? They have reassurance about the decisions that they're going to make at the bedside. So, what does this mean? Well, it drives better clinical decision making. It supports this competency based education framework that we know is so important. And then, third of all, it improves patient safety and outcomes. And ultimately, that's what we all want, right? We all want our patients to receive patient care. We want to receive safer patient care when we are in the hospital. And then the next step we want to think about is what's going to prevent us from becoming a barrier. Okay, so let's talk about what does that really look like? What does dependent learning actually look like? Well, first of all, it's relying heavily on guidance for every decision. Students that are hesitant to take initiative in a clinical setting, they are limited in their critical thinking. You can see maybe some wheels spinning, but the light bulb never comes on. They are also hesitant. Not only are they hesitant, but they sometimes withdraw from that patient's bedside because they are fearful. They don't want to make a mistake. They're thinking about the implications, the impact of making an unsafe patient care decision. So, what do we want to do? We want to make sure students have more practice opportunities where they're getting more feedback, consistent feedback that is formative, right? So, we're forming the learning. That's the intent of doing those formative assessments. It is for learning. We want to identify what is it that our students really know? What is it that they have a deep comprehension about? And what is it that's still a muddy point? Next, we want to consider how do we move forward? Okay, so first, in order to move forward, we got to think about what could be getting in the way. What kind of barriers could we be creating, right? So we have to own what's ours. First and foremost, if we're overly directive with our teaching styles, limiting student initiative, if we limit those opportunities for students to be self-directed in their learning, that could be a barrier. Next, if there's lack of opportunities to even practice clinical autonomy, if we're spending too much time focusing on didactic, focusing on theory in that classroom setting, that can be a barrier. We've got to engage and bring in those clinical experience, those application and analysis experiences into the classroom. We know Patricia Benner told us this a long time ago. High stakes environments, they discourage risk taking. So what do we want to do? Create more low stakes environment. That's going to be in the sim lab, in the skills lab, where we're supporting our students and making corrections by giving them feedback. And last point that we're making is around excessive supervision. That actually reduces learner confidence. So what could that look like if we hover too much in that clinical setting, right? We want students to have a chance to collaborate, to partner with the actual healthcare providers. Now, we want to ensure that we're doing our part as clinical faculty, but we want to give the students, especially our senior students, some time to really talk with other clinicians to really form their thoughts about clinical decision making in real time with the clinical partners. So let's take a look at this thought-provoking question and see what you think. A student repeatedly asked the educator to confirm whether each clinical decision is correct before proceeding. Which response best promotes the student's development? A, confirm the decisions individually and gradually reduce feedback as the student gains confidence. B, direct the student to review the clinical policy before requesting additional guidance. Or C, ask the student to explain the evidence and anticipated outcomes supporting the decision. When you get to a question on the CNE exam, we want you to ask yourself, number one, what is this question really asking me? And second of all, what is it that I know for sure about concepts related to this question? Okay, so number one, what is this question really asking me? And then second of all, what is it that I know for sure about concepts in this question? All right, so if you chose C, give yourself a round of applause. C is correct. Okay, so C is the correct answer. And let's talk about why. When you get to any thought-provoking question, whether you are going through content in our programs or using Kaputi's CNE review book, we want you to think about that. What is the rationale for the correct and incorrect answers? And we mentioned earlier that we were going to share this, so I want to go ahead and mention this right now. I know it can be very tempting to think that doing more practice questions is going to help you score higher on the exam. We have seen numerous times where that is not the case. Not only have we seen it, but NLN talks about it. There's no correlation with taking more practice questions and being able to achieve that passing score. This is what we do know. When you take the time to use the practice questions as a data point, the thought-provoking questions as a data point that gives you information about your possible gap areas, that's when real learning happens. So we want you to focus on spending more time clarifying your muddy points through Billings and Halstead as your primary textbook, okay? And spending less time focusing on finding more practice questions, okay? So focus on reviewing content, doing that deep review of concepts in Billings and Halstead, and less time on practice questions. It's all about quality, okay? Not quantity when it comes to thought-provoking questions, Kaputi's review book, or NLN self-assessment exams. Those are the only three type of questions. Those are the only three sources for the types of questions that are going to help you. Our thought-provoking questions, Caputi C&E review book, and NLN self-assessment exam. All right, so now before we go to the rationale, stay with me. I want to flip over and do a little bit of a visual for you all. All right, we know that not only do we increase our learning whenever and retention, whenever we're able to put pen to paper, but that's also true when it comes to drawing information. Okay. I'm somewhat of a self-proclaimed doodler. I don't doodle a lot, but I think it does help me kind of recenter my thoughts from time to time. All right. So let's see if we are sharing. All right. I'm going to stop sharing for 1 second and try to share again. What I'm doing is I'm sharing my iPad. Is let's talk about the three ways that we may be influencing our students and how can we change that? How can we do that better? All right, so first and foremost, let's just draw it in the form of a pie since we talked about three different ways. I know my drawing is not great, but it's purposeful, right? All right, so one way that we block our students' development of learning and that independent thinking is we rescue our students, right? So we talked about rescuing. So how can we move away from rescuing our students responding too quickly? And as we've talked about and the literature talks about, right, we want to focus on the value of silence and allowing our students to really process the information, the feedback that we're giving them. Okay. So the value of silence is important. The next challenge or barrier to supporting that independent thinking is going to be talking. Increase talking and decrease listening, right? So, what can we do? A solution is to reverse it, right? Spending more time listening, want to increase listening and decrease talking. Of course, we want to give supportive feedback, but not too quickly. And then the third barrier, which there may be others, and that's what I want you all to do to think about the barriers that you may be demonstrating that's leading to a block for and really a slowdown in the progression of students advancing to that level of independent thinking that we need them to. And I can tell you for me, it is increased high stakes experiences. So there have certainly been times where I didn't give students enough opportunities to fail forward, right? So how can we change that? Well, for me, we could have offered more open lab. For you, it could be increased SAM, right? Experiences in your curriculum. It could be increase case studies. So that's the activity we want you all to engage in. Think about ways that, first of all, drawing your pie, and just three categories is good, but three ways right now that you may be hindering that independent learning that we know is so important, because that's our goal. We want to increase independent learning. It's going to lead to increased quality for our patients and improve overall satisfaction, right, for everybody. We're going to feel better about the outcomes as the clinician, as the educator. Our students are going to feel better. Obviously, the healthcare organization is going to have improved outcomes and everybody wins, right? Okay, so now let's go back as we wrap up and take a look at our thought-provoking question and the rationale. I'm going to go back to Prezi now. So the rationale that yes, you're celebrating if you chose the correct answer, but we also want you to be clear about that rationale. Okay, so what we saw is C is the correct answer because it's an opportunity for you to really engage with students to have a deeper understanding about the rationale. All three responses could be appropriate, But B, what C is best, that should be C. So C is best because it makes the student's reasoning visible while shifting responsibility for decision making to the learner. Option A may continue the pattern of reassurance seeking, while B directs the student to a resource without requiring integration of the evidence into clinical judgment, okay, into a clinical judgment model. So again, going back to our options, it's C is the correct answer. A and B could be correct, but B really puts that responsibility on the student by asking them to review that clinical policy. And A, again, is just going to continue to require the student to rely heavily on us. Okay, so that's why C is correct. Oftentimes, B ends up being the correct answer, and that's why we forgot to change it to say C is best. We decided to change it up. I don't know how that happens, but it does. Okay, so as we wrap up with our last thoughts, strategies to foster independent learners, as we mentioned, Socratic questioning, reflective practice, the graduated autonomy has to have structured feedback and using simulation. You may have different your top three areas where you feel like you're hindering nursing students as a nurse educator from achieving excellence. So that's what you want to do. You want to think about your top three, put them in that pie chart, that pie diagram, because we know when we put pen to paper, or in this case, pen to iPad, digital pen to iPad, we're more likely to retain the information, and that's our goal. Your journey towards achieving that passing score on the CNE exam is not simply about achieving a passing score. Yes, we celebrate and we still track our success rate. We're still 98 to 100%. However, it's more about becoming a better nurse educator. All right, so wrapping up, three key takeaways. Number one, too much guidance on can weaken independent thinking, right? So we want to be that guide on the side as much as possible, giving students immediate feedback and allowing them, number two, to be productive in their struggle, right? That's part of the learning journey in a low stakes environment. Of course, if we're in high stakes, if we're providing direct patient care, absolutely, we want to make sure patient safety comes first. Takeaway number three, reflection develops self-directed learners. That's what we need as our students are scaffolding and building on their prior knowledge. We want them to have more autonomy, more confidence, more competence as we walk alongside them to provide reassurance, clarity, and directing them to resources, evidence-based resources to help them clarify their muddy points. That's that self-directed component that Malcolm Knowles talks about. If you're ready to move forward on your journey, it only takes 60 days. For me, it took me almost 8 years. Yes, you heard correctly. 8 years to get CNE off of my bucket list because I didn't know where to start, had a lot of competing priorities, and I was afraid of failure. Well, it doesn't have to take you 8 years. It only takes 60 days. And we hope that you enjoyed this snapshot. We look forward to seeing you in a future one. Have a great day, everybody. Take care.